I would like to talk about community mobilization today. Firstly, I would like to talk about how Save the Children has been engaging communities in Bangladesh over the last couple of years. Secondly, why communities come together to support maternal and newborn health activities. And finally, where the future of community mobilization going and how we should prepare for it. So our community mobilization work started in 2007 in Sylhet district in the northeastern part of Bangladesh. Currently in 4 districts, we have 23,000 community groups, and 3/4 of them have their own referral transportation that they manage, and more than half manage their own funds. Now in September 2011, we phased out of Sylhet, and 2 years later in 2013, we assessed what happened to those groups, and we found that 50% of these groups were running on their own without any support from any of the projects, which has been very encouraging. But at the same time, then we also wanted to find out why these committees came together and stayed together after we left. So we found out through the different studies that they felt a need in their community. They wanted to serve their community. There was a feeling of taking activities in charitable causes. They wanted to do good deeds for their Creator, the Almighty. They wanted to gain technical knowledge about health issues so that they could empower their families. And also they wanted to gain recognition from other members of their community. And because of these motivations, they were able to contribute in different ways. Firstly, by actively promoting health messages among their communities, referring mothers and children with complications to the nearest health facilities with their transportation and fund systems. They mobilize funds to repair health facilities, buy land for new facilities, and improve access roads so that the community could come to the facilities. They purchased drugs and equipment and other furniture wherever it was needed, provided information about new pregnancy, death, and service status to the health providers wherever it was needed. And not only that, we also found out that they were able to hold different service providers accountable and also come together for a stronger voice demanding quality service, which was very encouraging for us, because that meant that now these communities were empowered to act together and take collective actions on priorities that they set on their own. So then, what did it lead to? I want to give an example of Habiganj district, which is also in the northeastern part of Bangladesh, where we started community mobilization work between 2010 and 2014 as part of the Mamoni project funded by USAID. And in that project, utilization of prenatal services went up from 37% to 64% in 3.5 years, whereas in the poorest population, it went up from 21% to 48%, more than doubled, which was very encouraging for us, because it meant that by mobilizing community, we were able to increase demand, and we were able to make sure that the communities actually utilize whatever services were available. And similarly, skilled attendance at birth in that district almost doubled during that same time period. And among the poorest population, the poorest quintile, it tripled, which was also very encouraging. So that means that by mobilizing communities, we were able to ensure that poor people actually reach the services. So now finally, let's talk about what is the future of community mobilization. Where are we going in Bangladesh? So there's been a lot of demographic changes over the last 10-12 years that I've been with Save the Children. One of the big part is urbanization. We've also seen very positive trends in increased utilization of health services, lower fertility rates, and also across the board a vast improvement in education level of women. And that actually has led to more women empowerment, and we feel that in the future, in 20 years from now, all the community mobilization and any kind of activities would be led by women in their households, because now they're more empowered, more educated, they have more economic opportunities, and they have a stronger voice, which has been great for us, but we also need to respond to that. And also technology penetration has been widespread, and that has had positive and negative cultural effects. Some of that I can mention is that now everybody has a mobile phone. There's a lot of internet use in the rural communities. So that means that by use of social media, by use of their sense of community is also changing every year. And at the same time, they are more informed. A lot of the health messages that was not available to them before, now they can actually access it through their mobile phone and through internet. We need to make sure that overall how we can provide better service, how we can get them to take on, add on, and accept high impact services, and overall come together for better health and future for their mothers and our children. Thank you.